Well, this month is American Heart Month. We went straight to the doctors at St. Mary's Hospital for some things you should be thinking about when it comes to heart health.
For many years now, the American College of Cardiology and American Heart Association has been very involved in trying to educate the public about coronary artery disease and their risks. And a lot of that is focused on identifying risk factors and getting to know our own health patterns and know what we should do to make ourselves more heart healthy and more heart savvy. A big push now has been to urge people to further their evaluation of their own risk by testing. And by testing, we mean things like coronary calcium scores or stress tests or even invasive angiograms. Once we have the testing in hand and can see what your extent of underlying coronary disease is, we can then bring to force all of those tools we have to help treat your underlying coronary disease with risk factor modification, invasive evaluation, and intervention. But that first step will start with testing. There is a reason that coronary artery disease or heart disease is called the silent killer. In men who die of sudden cardiac arrest, fully half of them have no symptoms prior to their initial event, which is sudden cardiac arrest. So there are many tests available to your providers and physicians that can help us evaluate whether or not you have underlying coronary artery disease. One test in particular has become fairly popular because of its ease of use, and that's a coronary calcium score, or a CT scan of the coronary arteries to see if you've developed underlying calcification, which would be a marker of the development of coronary artery disease. Many physicians, myself included, will use this test as part of an evaluation for our patients who may come in with minimal symptoms or atypical symptoms, who have some risk factors or family history of coronary artery disease. And certainly it's been very useful in my practice to help first identify people who have coronary artery disease and then help guide their treatment, risk factor modification, and various medications. Now that we've talked about that, how would one go about starting this process? Well, certainly you could involve your providers. Call your provider, tell them you're concerned about the potential of underlying coronary artery disease, and ask them what steps they can help you take. Other ways of doing this, many hospitals, and ours included here at St. Mary's, have a program where you can call the hospital and get set up for a coronary calcium score. Once you have that type of a score in mind or in hand, then we can better estimate your risk for future heart attack or stroke, and then evaluate you for what kind of treatment might be necessary, treating your blood pressure, lowering your cholesterol, getting a handle on your blood sugars. We've made tremendous advancements in how to treat coronary artery disease, and those are available to people who find out that they have coronary artery disease, but we can't really offer those treatments until we get the first step, and that is to see whether or not you have underlying coronary artery disease. So my encouragement to all of you is to think about your risk factors, think seriously about getting evaluated for coronary artery disease, and if so, contact your provider or take the steps to do so.
To learn more about how St. Mary's Medical Center can work with you to improve your heart health, go to stmaryskc.com.